So let's talk about post-brain surgery. I had a craniotomy a week ago exactly in Chicago at Rush Hospital. And I told you guys we would go through this journey together. So let's do this. All right. I first want to say thank you to the surgeons and to the nurses, Nicole, Christian, and Andrew. They were amazing nurses. Thank you for all that they did for me when I got out of surgery. The craniotomy took about 5 hours. What they did was they actually cut into my skull and they were able to place the devices into my skull. They're about the size of the little button on the end of the AA battery. And they fit 34 of those on the surface of my brain. It took about 3 days to start feeling a little better. I am on some antibiotics. I am on some anti-seizure medications, and of course some pain medication. They also have me on some muscle relaxers because when I was in surgery, I was suspended on my left side. So I had some pressure on my hips and on my spine, and I'm gonna have to do some physical therapy because of that. I did have some numbing in my first 4 fingers on my right hand, but again, that's starting to come back and they're gonna do some physical therapy to help take care of it. So again, I wanna share all of this with you, and I'm about to show you what the actual bandages look like. I have over 30 staples in my skull, and if you wanna check it out, stay tuned. And if it's not for you, in now, and I will see you in a little bit and we'll talk a little more about the research.
What you're seeing now is a bandage covered with a transparent film stapled into her scalp. This is where they made the incision on her scalp. They cut at an upside down U shape with a width of about 5 fingers to make a skin flap to get to her skull. In the middle of this is where they cut her skull. After they implanted the ICVP devices, they secured her skull with metal plates and screws.
Guys, I am so sorry. My hair is so disgusting, but I cannot wash it until I get the staples taken out next week. So those of you that know me, sorry, my hair's a mess. And when we go get the staples taken out next week, we'll talk with the medical staff and hopefully be able to do some video then and share that with you also. So cheers with my mocktail. Thank you for joining me on this journey. Can't have a real cocktail for another week or two. So thank you again.